something I thought I would never say either. First of all, welcome back. Welcome back. But today we're going to be talking about female facial shaving, also known as, it's called dermaplaning. I've never heard that expression before, but evidently it's the biggest rage right now. And here to explain why it might be not as bizarre as it sounds is Los Angeles-based dermatologist Dr. Sonia Batra. Welcome, doctor.
Thank
Welcome.
you. Yay, doctor.
We're talking about, and Paige is also going to volunteer to actually do this. What are we doing on it? We're giving her a shave?
Basically, yeah. And so it isn't as bizarre as it sounds because this has become really mainstream lately. People used to be doing this behind closed doors and not talking about it.
Why are we doing this?
And so there was a reality star on a popular show on Bravo who came out and said she was doing this. And initially people were doing it to shave because they were removing hair or peach fuzz, just to give it a smoother look. But then they found it was a really effective form of exfoliation to take off that dry, dead outer layer of the skin, add more glow, and actually allow products to absorb better.
Okay, and you said this was seen on television?
So it's, yeah, I think it's become much more mainstream. It's on reality TV, it's on beauty blogs. Many celebrities are coming forward and talking about the fact that they do this.
Okay, there was a show, I think somebody mentioned at the top of the show today, that was you, Kim, that you saw this? We have a clip from that. This is from the Bravo show. Take a peek.
Babe, whose razor are you using?
It's my own razor. Purple. Yeah, I shave my face. I've been shaving my face for probably about 12 years.
Well,
okay, first of all, is it safe?
So it is in the right hands. So yes and no. Because remember, your skin is your barrier. It's meant to keep the outside world out. And if you take a razor to your face and you start making a lot of cuts and a lot of nicks, it's a great source for bacteria.
It's got enough on the leg, isn't it?
Yeah. So just imagine you don't want that on your face. So at home, you know, some people are using razors. They're at-home dermaplaning type devices. In a medical office, we do something called dermaplaning, which is also done by medical estheticians, where we're actually just buffing off that peach fuzz and exfoliating the skin.
okay.
Okay, here's the before and the afters, but
these are some of my patients who we've actually done this on.
Does it stay away or does it come back?
No, this is temporary. So remember, I don't usually recommend doing this more than once a week for exfoliation, but the hair actually probably won't grow back for a month or so.
Let me ask you something, the two that you just showed us now, the razor and the little, what is that little thing
So
called?
this is kind of a dermaplaning device, so it's a little different. It's not a safety razor.
What
Takes
would
a
you
little
suggest
bit
better?
more. I think if you're going to do this at home, probably get an at-home dermaplaning device because it's actually got a little bit more safety mechanism to it than just a typical handheld
Paige?
razor.
Paige?
Yes.
You're gonna volunteer?
What are you thinking?
I'm a little nervous. I can't imagine shaving my face, but in your hands, I feel like I'd be okay. But I have a little peach fuzz, and I can't get waxed. My skin is too sensitive, and I've also tried, or I wanted to do laser hair removal, but I'm not a candidate, I guess, because I'm too blonde, too fair.
Well, you need dark, coarse hair for the laser to actually target the follicles.
this
So when
peach
you
fuzz?
have
So
that
you're
fine
not,
peach
so it's
fuzz,
just,
it doesn't work.
well, how don't you hop on up here?
Okay.
And we'll see how this,
Go
while
on.
you're there, Kim, you have a question?
Oh, yes, I do have a question for you, doctor. So why is it that after a certain age, like after our 20s, all of a sudden you do start to grow more hair?
Well, that's hormonal. So the thing is, after menopause, our estrogen levels drop. And so we get this dominance of male hormones like testosterone and androgens like DHEAS. That actually acts on the follicle. It increases hair growth on the face. It thins the hair on the scalp. And so that's why a lot of women, as they age, do notice the peach fuzz is much more of an issue than when we're younger.
Wow.
So what's
Things
the
to
first
look
step?
forward to.
Yes, there you go.
It's awesome.
What's the first thing
So
you're
the
doing
first
here?
thing I'm doing here is I'm just wiping off any makeup, any oils, because if you're going to do dermaplaning either at home or in a medical office, the skin has to be really clean and dry. Again, we always worry about introducing bacteria. And also when the skin is really dry, the blade moves much more smoothly. So all I'm doing here is really just getting rid of the makeup and cleaning the skin.
And Orly, did you have a question?
Yeah, so I would be terrified that this would make like hair, peach fuzz turn into like hair, like it would grow back.
That you could go join the circus.
Yeah,
Be the
that
bearded
I
lady.
would go from having peach fuzz to like a straight up beard.
Well, so what's the story on that?
So that's actually a really common question that people ask me, and it's a complete myth. So it's not true at all, because what makes the hair sometimes feel more coarse is because you're cutting it at a blunt angle. So rather than the fine, normal taper of the hair where it grows out really soft, you see it more because it's a coarse, blunt edge. But when we do this, we're not actually affecting the hair follicle at all, so it will not grow back thicker or darker.
Paige, how does that? Well,
Yeah, how's
you
this
don't
feeling?
talk. You don't talk. You're just scraping the surface. Is that
So
what you're
yeah, so what I'm doing here is I'm using this very carefully dermaplaning blade to lift off. You see these little dust bunnies here. That's the little peach fuzz that I'm lifting off. I'm also just very carefully exfoliating the dry, dead outer layer of the skin, which is going to just make her skin feel much smoother. It's going to glow a little bit more. If I were doing a chemical peel or doing an at-home product, it would absorb a little bit better because we're taking off that outer, dry, dead stratum corneum
Let me ask
layer.
you, the hair that's above your lip seems to be coarser than the one on the side of your face. Why is that?
Again, that's hormonal, because we think that the androgen or male hormones kind of act a little differently on different parts of the face. Exactly right.
You know what, doctor? I have had this done a couple of times. And Christina, you probably know this. Right before the awards, many of the celebrities get this done for red carpet because your makeup goes on smoother. All of a sudden, it's like, think of a canvas on a picture, and it's super smooth now. It doesn't have any like little bumps.
Just real quick then, is this more for exfoliation first and then hair removal? Or is it, like, in other words, would you do this other areas that maybe there wasn't hair growing?
Should I put
You
that you wanted
could,
to
and
remove?
you absolutely could. So when we're doing this in a medical setting, either a doctor or a medical esthetician's office, we're really focusing on exfoliation. And the removal of the peach fuzz is almost like a nice side benefit.
It feels
and
like
exactly like Kim said, a lot of people will do this before red carpet appearances so that their skin glows and looks smoother.
I have one
Can you
more
tell a difference?
quick
Yeah,
sort of
please.
follow-up on what we were talking about. So you were saying sometimes it feels like the hair comes back thicker because it's a blunt edge. So will it feel like that on your face because it's going to be a blunt edge?
So you might feel it a little more as it grows back when it's still short. But again, as it grows out, you're going to see that tapering. It's going to feel a little softer. So so actually the hair isn't more coarse. It's just the angle at which it's being
So
cut.
what's the cost?
So different. I didn't even recognize you.
Wow, it's just so much softer on the side.
You're going to be touching your face.
What's the cost on something like?
So in a doctor's office, you're looking at about $75 to $150 per treatment. But you know, the at-home ones, you can buy a 3-pack of blades to use at home for like $5 to $20.
So if you go in to see you, it's about $100 for the shave and the haircut? I don't even get a rim shot for that. Thank you, thank you.
Like, or you can head to batraskincare.com. And next, Kim Douglas. And thank you, Doug.
What?
Thank you so much.
Me? I
Kim,
can't wait.
What are we doing
So
today?
now that Paige is all ready, I'm going to show you how to be perfect for your next selfie. Just like Paige. And the doctor.